Now we'll be talking about congenital birth defects. These are problems that develop while the baby is growing in the womb. Some can be very sad and hard for the family to deal with. It's important to talk about these issues to help families understand and find solutions to help their baby. I won't be talking about all birth defects because there are hundreds. The 7 I'll be talking about is Vocomilia, Down syndrome, VSD, cleft lip, deafness, sickle cell, and clubfoot. The first one I'll be talking about is VSD because I have this in real life. This is when there's a hole in your heart, especially in the lower part of your septum, which is your heart. This hole lets blood from your left ventricle go into your right ventricle. The blood without oxygen, the left side, mixes with the blood with oxygen, the right side, causing blood without oxygen to go to organs or muscles, causing you to get tired. The first signs of this are a heart murmur, which makes the heartbeat sound different, or symptoms that the doctors and parents see in their baby. Some effects are feeling tired, chest pain, having a big liver, swelling feet, trouble breathing, feeling weak, rapid heartbeat, and cyanosis, causing your skin tone to turn blue. Babies that have a big hole may need surgery to fix it, but babies with the small and medium holes have medicine or monitor with the heart doctor to make sure it closes. This little hole causes some blood to flow back into the right side of the heart, so the heart has to pump harder to get all the blood out of its left side. This pumping makes the muscles a little bigger. Babies like me with VSD are treated with water pills to help their heart muscles pump easier. I also needed other medicine to make sure my heartbeat stayed regular. The great news is, as I got bigger, my heart grew stronger, and I was able to be on less and less medicine until I didn't need any at all. If I had a large hole, the doctor would have sent me to surgery right away to fix it. My mom had to check my oxygen levels and make sure I never breathed so hard or got blue lips. I also tended to sweat more because my heart was working so hard. Now I feel great and I'm still thankful for the excellent doctors. Another one of the birth defects is Vocomilia. It involves the arms and legs. The brain gives misinformation to the developing arms and legs, causing them to grow disformed or not grow at all. One of the causes for Vocomilia is a drug called thalidomide. Another thing that causes this is genetic inheritance. Fortunately, we don't use thalidomide anymore because it's dangerous for growing babies. Another birth defect is Down syndrome. This disease is when you have an extra chromosome. This abnormality produces specific facial features such as slanted eyes, low steady ears, and protruding tongue. It could affect many different body symptoms such as learning disability, heart problems, low muscle tone, and unfortunately it can cause a shorter lifespan. Some risk factors are the parent's age, and if the mom had Down syndrome, the kid has a higher percent chance of getting Down syndrome. Another birth defect is cleft lip. This happens when you're an embryo and your mouth doesn't separate away from your nose, causing it to stay like that even after you're born. The only good part about this is that you can have surgery to get this fixed. Sadly, before they had surgery, they could not get it fixed. Therefore, they had cleft lip even when they grew in teeth, causing breathing problems because teeth grew into their nose. Fortunately, now most babies will be fixed right away. Another birth defect is deafness. This is when you cannot hear. Infections the mother passes to her baby, such as measles, herpes, toxoplasmosis, can cause deafness by damaging the brain and ear. Other causes are premature babies or trauma to the growing baby. There is a solution though. Hearing aids allow kids to hear and usually live a normal life. Though they may feel sensitive about their disability, we must always treat everyone the same to help these kids feel included. Another birth defect is sickle cell disease. This is when your red blood cells are shaped like a quarter moon, called the sickle cell. This causes the red blood cell to die because it's not in the proper form. This leads to shortage of healthy red blood cells, that carry oxygen and blood. Sickle cell can cause pain in the joints and sudden pain in the chest. It can cause you to be dizzy and have low oxygen. These kids have lifelong problems with pain and may need blood transfusions. We hope to find more treatment. The last birth defect I will discuss is clubfoot. This is when your foot or feet twist or go backwards. It can cause you to have trouble walking and or have shorter legs. You have special shoes and might have a brace for 6 months to a year. And if that does not work, you might have to get surgery. This disease causes no pain anywhere besides maybe the foot. Nobody knows what causes clubfoot, but they do know that if your family somewhere down the line has had clubfoot, you have a higher percent chance. In conclusion, I'd like to thank you for listening to my TED Talk about some known congenital birth defects. I hope you learned something today. Have a great day. Bye.